I want you to leave today's lecture with a different worldview. Hopefully some of this information can expand how you see the world. I want you to have a better understanding of structural integration and how it differs from other treatment paradigms. Lastly, I want you to be excited about the potential to transform your own life and the lives of your patients with Global Lifestyle training. I know we all like to see the results. That's where the rubber meets the road. So I want to start by waking up the part of your brain that's visual and likes to see these. This is the result of a structural integration session performed by one of the recent Global Lifestyle graduates, one of Murtaza, Ezzi classmates. What's your vision of yourself as a clinician? I know most of you are physical therapists. And there's many things you can do in physical therapy, right? You can be someone that focuses on exercise. You can be someone that focuses with technology and machines. And you can be someone that focuses in manual therapy. And you have the flexibility to do all of this. This talk is designed to bias you towards manual therapy, specifically structural integration. Why do I want to do that? It's because of the deep connection and lasting impact that we can have with manual therapy, specifically structural integration. This type of interaction with our patients can be a life-changing event. So we're moving beyond the goal of just making someone have less pain or more range of motion. We actually want our interaction to be a catalyst for radical change. What is structural integration? It's a ritualistic experience of somatic and conceptual stimulation. So we are working with their soma, their body, and we are also working with their mind and their spirit. And we're teaching them how to know more about themselves. Structural integration provides an expansive therapeutic container, and it serves as a powerful catalyst for massive growth and radical change in one's structure, psyche, and spirit. The goals are big. Now, we've all seen these type of pictures, and I just want to show you that it's not just advertising. We actually can impact the structure, and this is someone that was processed through the traditional 10 series of structural integration. So I just want to let you know that these drawings are not just for marketing, that they actually come true when someone learns how to do structural integration. But it's not just about their physical structure. That's just the way we get access, because the body, the physical layer, matches everyone's belief system. We are complex creatures. And when we learn structural integration, we're learning to see the whole person. What's their education been like? What's their social, cultural, and spiritual context? What's their relationship with money? What are their caring relationships like? What's their professional context like? What are their habits for personal care and well-being? Do they know how to take care of themselves? What have their interactions with other types of treatments been like? Medical, psychological, what's their home situation like? All these things factor into threat perception. And modern pain science is telling us that threat perception is what drives pain output. So pain is actually not something in the body. It's not a noun. Pain is an experience that people have. It's a verb. Let that sink in for a while. It's a verb. It's an experience. So that's why we have to understand all of these contextual factors that could increase their threat perception. If we can lower their threat perception, then they begin to shift in all aspects of their lives. I like this picture because it shows that even someone in the late stages of their life, in the late stages of their life, can still benefit from this work of structural integration. Part of that is because it's principles driven, and we have, So we have principles of adaptability. How can we help the person become more adaptable to challenge and to change? Because change is constant in our lives. The next principle is support. How can we help them to find more support through their structure? And we also need to understand how to help them find supportive relationships in their lives. That's as important as their structure. Palintonicity is a fancy word for expansion in multiple directions at once, in multiple planes. So we're not just looking for vertical length in the structure, we're not just looking for circumferential expansion, we want it in all three planes. We want the person to be able to expand into challenge, not contract and shy away from challenge. Holism, we're looking at the entire being, not just the physical body. And closure, the traditional 10 series is a ritual with a beginning, a middle, and an end. And it's important for both us as the therapists and for the patient that they know that it's a discrete body of work, because we want to create a sense of self-sufficiency. We do not want to create dependency. That adds to threat perception. Why do people come to see us? It's because they're suffering. And if we get to the root of it, all suffering is because we've forgotten our true nature. I love teaching in India because this is woven into your culture already. When we are aligned and have access to our deeper selves, our true nature, we don't suffer. That doesn't mean that the body can't be ill. It might have pain, there might be some limitations from some disease, but when we're in touch with our true nature, we know that the body is not us. This is an important distinction, and it doesn't mean that we don't work to alleviate the pain, we don't work to help them function better in their body, but we also need to reconnect them with their true selves. A highly skilled structural integration session can work on both of these levels. I love this analogy. If we look at the study of the ancient science of yoga, most people will focus on the asanas and the physical postures. That's just one of 8 limbs. The deeper stuff is what it's really about. It's about the cessation of the fluctuation of the mind. So this analogy shows that the presenting symptoms that they bring to us, that's just the tip of the iceberg, so to speak. We need to be skilled enough to realize what's going on for the whole person. What differentiates Global SI training? Well, hopefully you can tell by what we've talked about so far that the goals are big. We go there with people. We spend enough time, we create enough rapport so that we can tap into these deeper levels. Personal transformation through radical self-awareness. Again, it's not enough just to help the person have better range of motion or less pain. We need to reconnect them with their true selves. We use a full biopsychosocial lens. We're not just working with pathology. And we devote sufficient time to establish strong therapeutic relationship. If you look at the current literature, the primary driver of outcome is the therapeutic relationship. I could spend a whole day lecturing about that, but I at least want to plant the seed in this time that we have today. What else? SI is a process-driven therapy, not an event-driven therapy. An event is you have an injection, you have a surgery, you get an adjustment, you do an exercise. A process-driven therapy is you take a journey with your patient and you coach them and you help them get in touch with parts of themselves that they have forgotten. It's a ritual, and the patients have an expectation of change for themselves. I can't stress how important this is, because they will know when you sign them up for this process that it is about radical change. Just having that expectation is a huge part of opening their availability for how far they can go with the work. We also have the luxury to allow for and expect nonlinear, individualized outcomes. This is very different than differential diagnosis paradigms where we have symptom X, Y, and Z, so we perform treatment A, B, and C. This is reflective of our emphasis on the central nervous system over the peripheral nervous system. We are focused on shifting their perception. There's a constant focus on the whole person in front of us. There's a deep understanding of how the parts relate to the whole. So I keep trying to make the lens big, but the bread and butter of structural integration, it is a manual therapy. In my opinion, it's the best one, and I've studied lots of them. And we get a deep understanding of the parts relate to the whole. How many times have you had someone come in with a shoulder problem, and you keep working on the shoulder, and it might feel better for a few days, but they come back to the same thing? If you go through structural integration training, you're going to start to see that shoulder problem might be a problem in their foot or their ankle. That's just one example. Emphasis on dynamic patient assessment. Most of us were trained in static assessment. We look at the person standing, we look for how they compare to a grid of right angles. Structural integration, we focus a lot on their gait, in their movements, how they use their bodies. And it's lovely because we call it body reading. And it's nice to see some of the students that have studied structural integration with me in India, and we are the first school. We just graduated the first batch of graduates after 2 years of training last December. And it's nice to see this trickle out into the education environment in India. I've heard from people that this type of body reading, this gait assessment, is now being included in classes for cupping and needling and other manual therapy. So this is a key part of structural integration, and it's nice to see that spreading. There's a large emphasis on embodiment of the work by the practitioner. We have to understand what structural integration does, not just intellectually, but in our own bodies. That's why if you choose to do the training, you will receive the entire 10 series from one of your classmates. And this is probably the most important piece of learning that happens. I would recommend all of you, if you're interested, to find one of the recent graduates. Go through a 10 series. That's going to let you know the power of the work. And we also emphasize embodiment of the work by the patient. It's not just enough to fix them or work on them. You have to work with them so that they own the work. There's a large emphasis on the practitioner's internal state while treating the patient. If I'm anxious or busy in my mind or my nervous system feeling anxious, then I'm not giving a good reference point for the patient's mirror neurons to resonate with or attune to. So Murtaza can speak to this. Every time in class, before I let them touch each other or their outside patients for the practice clinical hours, they first have to calm themselves, center themselves, ground themselves. We're actively working to lower sympathetic nervous system arousal. Most people are overstimulated these days. Too many electronic devices, too busy schedule, too much thinking. So all this leads to increased threat perception. Rarely you might get a person that needs to be woken up, but that's the exception. Most people these days need to downregulate their nervous system, get them into the parasympathetic side. There's an emphasis on proprioception. We teach the person to understand well where they are in space. And there's an emphasis on patient education. We're not just working on them, we're working with them. And we need to teach them how to better assess how they're feeling at any time and how they can make decisions that make them feel better. The Globalist Lifestyle of structural integration engages the patient on more layers than any other modality. There's a therapeutic relationship, highly skilled listening touch. It's not a doing touch. It is using your hands as information gatherers and allowing the body of the patient to tell you what it wants from you, when it needs help. Focus on interoception. If this is a new term for you, It is about deeply being able to feel what's going on inside. And this is a physical thing, and it's a perceptual thing, but this is the stepping stone part of SI that leads to reacquainting oneself with their true nature. It's this inward focus that we are training. And verbal cues. We give lots of very specific language that speaks to different parts of the brain to help us get the outcome that we look for. Visual cues. We often give things for them to imagine so that, again, we're affecting more layers of the brain. It stacks the deck in our favor. Movement coordinative repatterning. We work to help them understand how they're moving and how they might move better so that they can own and hold the work. Mind management. How are limiting belief systems affecting their well-being? Self-awareness. Pain education. Understanding how pain works. And the ongoing growth of the practitioner. I cannot stress this enough. You cannot take your patients where you have not gone yourself. I believe the globalist eye methodology has the potential to not only straighten someone up, as we saw in those pictures that everyone likes, and free them up and get them fluid in their bodies, but I want to wake them up. And I always like to show this picture. It's a sacred mountain in Tamil Nadu that I visit when I come to India, and it's changed my life. And I want to thank you all for your time. Hopefully we've sparked some curiosity, and now I will turn it over to Dr. Murtaza, a recent graduate of Global SI. So I'm going to switch to his presentation.
Dr. Derek?
Yes.
Are they able to see the presentation? Actually, I could not see that.
I hope so.
Yes, presentation is visible, sir. Slides are visible.
To everyone?
Okay.
To everyone?
Yeah, sir. Yeah, everyone.
Okay.
Might be because you're on your phone. Can you see your own presentation, Murtaza?
I have mine. You can share
No.
it with there.
Okay, it's shared.
Okay. Shall I? It's done?
Mm-hmm.
Am I visible? Himanshu?
Yeah, you are visible. Yes, you are visible, sir.
Okay.
Would you like to share something? Or you will continue with this?
Yeah, I will continue. That's it.
Okay.
Okay. Hello everyone. There is lots of sound actually.
Hello.
Himanshu.
Yeah, yes, sir. Just a minute. So good evening, you all. Sorry for interruption. So again, welcome to our next resource person of the day, Dr. Murtaza Ezzi, sir. Dr. Murtaza is a senior physiotherapist and working in the field of structural integration with the Dr. Derek Gill. So I would like to thank you for your kind and enlightening words. Can you hear the sir voice?
Yes.
Yes, please, sir. Over to you, sir. Most welcome to you and heartiest welcome to you.
Okay. Hello everyone. I am Murtaza Ezzi, practicing in Udaipur. I am a physiotherapist and a graduate SI practitioner from Global SI School, USA. As Dr. Derek said, SI is a process. Yes, it includes techniques also, but which should be used in an organized way, keeping these 5 principles of SI in mind. If you are not using this SI principle, it is not called an SI work, then it is a technique based process. okay, then it is not a SI process. It is just a technique you are using. So these principles are pillar for SI work. Also, important for both, these principles are very important for outcome results and also long-lasting practice of a practitioner. If you want to be a good practitioner, then you should keep these pillars or principles in your mind. Yes, these principles are just not meant for SI also. You can use in your daily practice also. If you are using these principles in your daily practice, this is going to change your practice. Though if you are not an SI practitioner, this is going to change your practice. So now we come over to the case presentation. As you can see, again I am going to repeat the principles. This is first is support, adaptability, holism, paleotonicity, and closure. Now we are going to discuss the benefits of SI. SI has broadly physical and metaphysical. Metaphysicals are nothing but non-physical benefits. So first I am going to say you about physical benefits of SI. Physical, with the help of SI, you can treat your patient and get relief of local pain, stiffness, range of motion, endurance. What we are getting this kind of patient in our daily practice. Endurance, chronic illness, systemic illness, physical body balance. And metaphysical includes emotional health, psychological health, spiritual health, and overall balance. And I personally want to share, I have treated many patients, just not physical but emotional problem and also with systemic illness. Example, if some patient is coming to me with burping, continuous burping, like patient comes to me and say like, whichever place you touch, I start burping. With help of SI, I have treated them and they have got well. I have treated patient with emotional health also. Physical, I would like to share constipation. I have treated patient with PCODs. Many patients got treated. So these are the basic benefits of SI. Now I am going to come to the case presentation and we are going to discuss how I have dealt this patient with SI process. A patient came to me with bilateral heel pain and shoulder pain. Okay, and this was the presentation of the patient. Okay. In this SI process, first thing is we have to build up a rapport. And how you will build up a rapport? By not using a nocibic term. Never use nocibic words. Example, never use deformity or never use you are having this problem or something like that. If you say so, patient get demoralized. And if you say that, no, you are having this thing good in you. Example, your shoulders are well balanced, your neck is well balanced. Patient will feel confident in you, and you will, that time only, you will make a good rapport with your patient. So if you make a good rapport, means half of your problem is solved. You have got the confidence. Now you can, because in SI is a process where you are not only working, you are working with patient and you simultaneously are working and getting the results. So making a rapport is a very important thing. Second thing, now will come, as you have seen this patient presentation, according to SI, we have divided this SI, for your understanding, I have divided into three things. First is building up a rapport with the patient. Second, it comes body reading. Body reading, it comes static and dynamic. Static, there are few things we notice like front profile, side profile, back profile, everything we see in the static assessment. That is called static visual assessment. Then it comes dynamic. Dynamic is nothing but assessment with movement and walking, both. Then third thing is come strategic plan. And this everything what I am discussing is for this particular presentation. It is, I am not discussing everything about SI. I am discussing just about this presentation, how I did SI in this patient and how patient got better. So one more thing, I would like to share, no human body is perfect, or it's I would say, like many of as a physiotherapist we say that, okay, this is the ideal posture or this is a good posture. We cannot decide that, because every individual or every human has its own posture, and by doing body reading we are comparing balance between the relative segments of the body. Example, neck with the shoulder, neck with the shoulder, shoulder with the chest, chest with the pelvic, abdomen, everything like that. You cannot just compare everything like as a whole. You have to compare segmentally. Okay, now we are going to come to the case again. During the static visual assessment, you can see in the slide, the one where both the legs are having less freedom, I would say less freedom on the lateral side of the leg. Okay, so you can see the presentation of the leg. The lateral leg requires more freedom. Lateral side of the foot also requires more awareness. Medial side of the foot also required more awareness. Yes, and with this presentation, the patient was also having pain in the shoulder that I could not take the photograph, otherwise I would have shown. That I also going to say how I have treated that patient with SI. Now coming to the again static visual assessment slide, the patient, see, you can see that many types of feet we can always observe. Like in the first picture, you can see that there is less of freedom on the lateral side of the leg, and other picture you can see there is less of freedom on the medial side of the leg, both the leg. Okay, so I found out this, patient need, this is my basic need, patient need length on the lateral leg, bilateral, and freedom on the lateral foot, and more awareness about the medial side of the feet, bilateral. The next picture, what you can see, a human body. This was the presentation of the patient when I did the all other examination, when she was complaining of the shoulder pain. There I found out that patient was well balanced, okay, relatively pelvic, shoulder and everything, and this was the thing I found out. And there I treated her with, there was imbalance between her bilateral serratus anterior and latissimus dorsi for the shoulder pain when patient came. That I could not show because the patient picture is not there. Now we can come to the dynamic visual assessment. When I made patient walk, I could found the back of her leg also required some movement, some work. So dynamic assessment I have not video I have not included because I didn't have. Now we can come to the strategic plan. How I planned that patient so that patient got better. In SI there are 10 sessions. So patient came to me, I decided by body reading, static and dynamic, I decided to go for session 1. Session 1 is known for freeing the breath. Why it's called freeing the breath? Because everyone breathe 24/7, okay, and as SI is a balancing for overall balance of the human body, so every cell of our body needs oxygen and we breathe 24/7. So by first session, when I took one first session with a patient, freeing the breath, patient felt so relief, and I used technique called piano key technique and protector technique. After the session 1 only, the patient pain was relieved from bilateral heel and bilateral shoulder. I never touch her heel and I never touch her shoulder. I just did the freeing the breath process, and patient was not having pain at heel also and at the shoulder. As Dr. Derek said, okay, we have to treat the root cause. Okay, cause can be anywhere, but pain will be manifested somewhere else. So if you are treating the root cause, the pain will go. So in session 1 only the patient pain was disappeared. Then patient came after 1 week, there was no pain, and because I wanted to correct the presentation of the feet, bilateral, and her shoulder also, I called patient to go for the session 2. Then we started the session 2nd, and I did foot mapping, hunting for the heels, lengthening of the lateral arch as it was required, and squeeze and dance technique for the patient. Then you can after the second session, you can see the change in the presentation of the feet. Can you slide to see it? Hello?
Yes, sir.
Hello.
Yes,
sir. Yes, sir.
Okay, so now you can compare that before SI, how was the presentation of the feet, and after the session 2, session 1 and session 2, you can see the difference between the feet. The presentation has completely changed. The patient has got different alignment, which it should be like, it should be comparatively from the ankle and the leg, comparatively the alignment is much better. Okay, and you can see that I am not using any word like deformity or any problem like that. We never use such words in SI. We always use positive, good words, so that it can encourage or motivate the patient. Now we can come to the session 3, discovering the can you just shift to the strategic plan?
Yes.
Yeah, session 3 is called discovering the dimension. Discovering the dimension, why I choose this one, because I wanted to have proper presentation in her shoulder also. So I used this technique, QL plus 12th rib technique, magic spot with park and hold technique, and the moneymaker technique for shoulder and neck. I used this, and the patient presentation was totally different from the time when she came to my clinic. And after 3 sessions, means only 3 hours of work, patient was completely relieved from her shoulder pain and heel pain, which she was suffering from last 3 years. And before coming to me, she has visited many orthopedicians and many other consultant, but she could not relieve anything. Nowadays we always use, like, if we see this kind of presentation, like what kind of presentation the patient is having, we always suggest use the medial arch, you will be fine. But every patient doesn't get better with the medial arch. You have to correct the presentation. Yeah, this was the physical benefit of SI. Now I would like to share the emotional, the metaphysical part of the SI. One patient, she was quite young, and she came to me, and she was my old patient, where I have treated her for neck pain. So after 1 year, she came to me, and all of a sudden she said, "I am having knee pain." I examined her. I didn't find anything wrong in her knee. She was done with MRI or CT scan and many things, and she is from Delhi. She did. Doctor in Delhi told her to go for the knee replacement for nothing. She was just having knee pain, and the doctor said there was no deformity, nothing. The presentation was very fine. There was nothing wrong with her MRI or CT scan, and she was told to do replacement. Then the patient came to me, and then that time only I decided that she needs a session of structural integration. I did session 1. When I was doing the session 1, patient started sharing with me that I had a brother and he was suffering from jaundice. I have lots of money, but I could not help her. She was in a grief of her death, her brother's death. That was eating her. So when I did the integration session 1, and when I did with the piano key technique, she started crying. She burst out with cry, and I let her cry for 15 minutes. And then again she said, "Okay, this is the guilt which is eating me." When I finished with piano key technique, and when I done with the SI, and she could walk properly, and without pain. And after 1 week she came and she said, I have no pain now. So this is the benefit, how you can release emotional grief from the patient and patient get benefited. Because many of you are practicing, you are well established practitioner, and you must be seeing all such kind of patient that you treat everything but patient is not getting well. So what is the reason for not getting well? That sometimes there might be, this is the reason, that patient might be having something emotional, something psychological stuck inside. So we have to get it out, then only the patient get better. Physical part of the SI. Now I would like to share the spiritual part, how you can balance, and that thing has happened to me myself, because I myself has undergone 10 series with Dr. Derek. And how I have changed my practice, I would, and how I have changed, I should join it. And in the beginning, it was looking to me like it's a very slow process. But when I learned session 1 and session 2, and when I started to practice on my patient, I got maturity in myself as a practitioner and as a normal individual as well. It was, I would share, like it was like a coconut to me, like looking hard from outside, you know, very hard at first glance. But as I learned this work and went through the 10 series, believe me, it became very fast process to transform myself from what I was and what I am right now. And in terms of everything, like in a physical balance also, I'm feeling something different, and in emotional and overall health, I have changed myself. The changes what I felt, I've got self-confident very high, very high. What I was having confident, but after SI, I felt more confident. I got more calm down. As Derek said, most of the people are sympathetically high. So I really got better after the 10 series. I learned, and very important thing, that I don't know if I don't know. In front of patient also, if I say directly, okay, if patient comes to me and I see that I cannot treat you, I just say that I cannot treat you. That I have learned from SI, and I really feel self-control. I have control on myself on many aspects. And after doing SI, as Dr. Derek said, I am able to find out the root cause of the problem. If patient comes to me with a back pain, but I can able to find out the root cause, that might be in the mouth, or it can be somewhere else in the foot also. And I really got the answer, what I was searching from many years, being a physiotherapist. Yes, I have learned many things from physiotherapy, but what I have learned from SI, that is something different. That's what I'm sharing to you. And now I can decide also, okay, what patient I have to treat and what patient I cannot treat. Last, I have got a concentrated eye. I have an extra large magnifying lens in my eyes now. I don't know. Yes, it is. So it is making me possible to see the invisible things, and it is making me see the things which are not visible for others and which is now visible for me. Example, I will say that a patient is coming to us with an X-ray. Okay, we can see that as a physiotherapy, most of them are physiotherapists, so we can see that there is a medial line, space is reduced, some osteophytes are there. Okay, we can see that. But now in that image also, I can see through SI many other things. What I have to balance so that I can reduce this. That is clearly visible in the X-ray. So this is from my side as a case presentation of SI. And now I like people who have any doubts or question, they can ask me, Dr. Derek, and I am available. Himanshu? Himanshu? Dr. Himanshu?
I can hear you.
Others are there?
Murtaza, can you hear me?
Yeah, I can hear you.
Okay.
Himanshu, Dr. Himanshu.
So it looks like there's still 19 people. If anyone has questions, you can type them in the chat box and we can answer them that way. So someone's asking if there's an online course for SI, and as you say, yeah, it's kind of a hard thing to learn online, but I will say that because of COVID, we're all exploring how we might do that. So I, over the next year, am looking to develop a 100-hour intro course, but it's in process. It's not available yet. So at the moment, the school's just doing lectures. But over the next year or two, we will have an online course. But you'd still have to come in and do the hands-on work just so we make sure that you've actually learned what we need you to learn to be able to practice SI safely. Please explain the piano key technique. I'm going to let Murtaza take that one. Murtaza, are you still with us?
I'm here.
Someone's asking the benefit of the piano key technique.
Yeah.
Can you take that one?
Piano benefits of piano key technique, or like what?
It just says please explain. Can you see the chat box, Murtaza?
Explain the benefits of. Yeah, I can see. I can just wait. I can read. Please explain the benefits.
Yeah, I'm going to take the next question one more time.
Yeah, it's am I visible? I am visible?
Yes.
Yeah. In session 1, freeing the breath, like piano key technique is about the alignment of the rib cage, rib basket. We are working with the rib basket so that it synchronizes with the breath. Okay. If anything is the presentation of the breath is not going as it should go, we are helping the patient with piano key technique so that it gets synced with your normal breathing process. So it's basically the working with the rib basket.
Yeah,
because
go ahead. It's the patient's in a supine position, and we're able to work along the rib angles in the back. And you look for if you think of a piano there's white keys and there's black keys that are raised up from the white keys, right? So if you turn the piano keys upside down, then the black keys are lower than the white keys. So then as you're feeling underneath the patient's body, you look for the ribs that are lower than their neighbors. And those are the ones you treat. And there's a location that we teach to access the rib on the posterior side, and then we also look for that same rib on the anterior side. And we work with the breath mechanism to bring that rib back into balance with the neighbors. There's another question from Dr. Avis. Please explain the benefit of all 10 sessions. So, the benefit of the 10 sessions is multiple. The first thing is that you get a chance to spend 10 to 15 hours with the person. So your connection with them, your therapeutic relation becomes very deep during that time. It's also very thorough because you will systematically go throughout their entire body, starting superficially in the first three sessions, which are called the sleeve hours, where you're preparing the superficial layers of the body and balancing them, and that's preparation for the core hours, which are sessions 4 through 7. And those sessions, we're beginning to work with the endoderm, the visceral layer. So we're working with the pelvic floor directly, we're working in the organs, we're working, eventually we wind up doing intraoral and intranasal work along with cranial suture work. The last 3 sessions are the integration hours. So now we're starting to come back out of the body, prepare the person for the closure of the series. So, while you might think that 10 sessions is a lot, actually what we get done in 10 sessions, it would take in other paradigms 50 sessions or more to get the same work. And because there is magic in the sequence of the recipe, so that's another benefit of it. There's a question about the gist of the techniques used in SI. I assume you're talking about some of the stuff that Murtaza mentioned. I don't know that we have time today to go into all of the techniques. I guess if I had to generalize, we probably spend more time at a particular place than most other modalities because we have to establish a connection with the person's nervous system, and if you're moving quickly all the time, they don't have a chance to self-regulate to the contact. So if I'm trying to get, let's say, an adductor to lengthen where it inserts on the pubic ramus, that's not going to happen in 30 seconds. Sometimes, and you might have heard the term park and hold come up, sometimes I might have to stay there 8 or 9 minutes just to get that kind of a core structure to open up because we're having to convince the person's brain that it's safe to let that go. In an area like that example I gave around the pelvic floor, you're dealing not only with the physical structure and it's a core structure of stability that helps us stand upright, but you're also dealing with a core structure around the root chakra and the emotional aspects that go along with that pelvic floor area. So that's how I'm going to answer that question. We make sure that we spend enough time in whatever that we're doing that we get the change that we're looking for. Let's see. Is Rolfing included in structural integration? Are we making it less painful in SI? Good question. So they're basically the same thing. Rolfing is a trademark term that is owned by the Rolf Institute. That's where I went to school, so that's why I can call myself a Rolfer, and that's the school Dr. Rolf founded. That was in 1971. 2020, there's 21 schools that are approved by the International Association of Structural Integrators. And if you go through, and Global SI is one of those, and if you go through those programs, you're eligible to sit for the board certification. So the broader, Dr. Rolf herself called the work structural integration. People just started calling it Rolfing because of her. So it is actually the same work. But your question about it being less painful, I think you've done some research, because when Rolfing first was practiced in the early the 60s and 70s, there was no allowance for that we were working on a nervous system. They actually thought that we were changing the state of the tissue from a gel to a salt state, and we're able to manually alter the fascia that way. There's been a lot of research that pokes holes in that explanatory model. So when Dr. Upledger came and spoke to the structural integration faculty and introduced the sacral touch from osteopathy, that began to change the field of structural integration. So we still have that heavy touch that is sometimes needed, but now there's a full spectrum where we can also work very lightly with that cranial style touch and everything in between. And that's one of the reasons it's a little tricky to teach and explain this work, because what we really have to train the structural integrator to do is to be able to listen to the person and assess where they're at in their nervous system and what kind of touch they need. Not everyone that walks in the door can tolerate heavy touch. Not everyone that walks in the door will respond to light touch. So you have to be skilled enough as a practitioner to not only assess what you want to balance in their structure, but you have to assess where they are as a person and what kind of touch they're going to respond to the most. And that's an art. Are there any other questions? I know we're a little over time because it took me a little while to learn the new system this morning. Just scrolling through to make sure I didn't miss any other questions. Okay. Well, it looks like that's all the questions. Again, I want to thank Physio Inculcators and Dr. Himanshu for the invitation.
Hello sir, am I audible? Oh भाई किधर है?
Yes, audible.
Hello. Hello. Yeah. Thanks a lot, sir, for your kind explanation on the question. And I'm extremely sorry because there is a lot of network trouble on my end, so I has been disconnected 2 to 3 times. So I was standing outside to attend the session. So sorry, I know that you may have announced the name, and I was not being able to attend the question and all. So I am extremely sorry, sir. There is a network issue, though I was outside. So again, sir, it is a heartfelt thanks to you that you have spent the time, and definitely the structural integration is something very different. I think I have learned just at first today that this is something which can create magic in the patient, and as definitely if we'll have more techniques, more skills in our armory, then definitely we'll have more skills in the management of the patient, and we'll definitely have more outcome in the patient. So we would be love to learn this technique, this magical technique, basically I would say, the structural integration and the roll for techniques. So I think we are just a newcomer for these techniques, so we would be happy to learn more about this, and we are heartfelt thankful to you, sir, Murtaza sir and the director, And special thanks to the Murtaza sir, that because of you only we can meet the director and we get a opportunity, a great opportunity to learn from directly from the Dr. Derek, long away from the USA. And I would also like to inform you, sir, that in our sessions that we have the participants from all around the globe. We are also having the participant. They are joining us from the Saudi Arabia. Dr. Amita Anup Sharma. She is a senior physiotherapist there in the Saudi Arabia. She joins us regularly. Along with them, we also have some more senior physiotherapists. One is Dr. Charu Sharma, is my teacher. She is joining us from the Washington, USA, and she is a physiotherapist, certified physiotherapist there. And we are having the other senior faculty members, my teachers, academicians from all around the India, all the places of the India. There is a few physiotherapists, a senior physiotherapist, Dr. R. Arun Moji sir. He is the associate professor in the Dehradun, SBS University Dehradun. We had also joined with the Dr. Jeban Daniel sir. He is a principal in the Choitram Medical College in Indore, MP, and many other senior physiotherapists. So we are also thankful to all the participants, all the senior academicians that have spared the time to join us, and we are feeling such an honored and blessed to have all the senior members and director and Murtaza sir here on the board with us. We will definitely be thankful to you, sir, always, and it is a matter of honor for us that you are with us here for this session. And interestingly, we have finished with the all question answer, and this is again thanks to you, sir, that sir is providing their mail ID. If anybody has any query, they can directly contact to the sir, even though regarding this technique. If someone wants to learn more about the technique, they can directly contact to the director. Thanks a lot, sir, for sparing your precious time, even though you are so much busy. I can understand in this so much busy schedule, you can find out the time. So thanks a lot, sir. Derek sir, you are not audible, I think. Yeah. Voice system is coming. Would you like to say something? Or
Yeah, just again, thank you for the invitation among such. If you're interested in instructional integration, I put the school's website. And I would also encourage you on the website is a list of the recent graduates. The best way to learn about this is to go sign up for a 10 series with one of them in your area, because as much as we try to explain it with words and concepts, the best way to really understand the power of it is to feel it in your own body.
thank you, sir. Thanks a lot for such a great explanation, and we are delighted to have you with us. At the last, there is information, as we are also having a session tomorrow at 9 p.m. So be stay tuned. This is a new application. Many people may be having some trouble while logging in, but within 1-2 days, I think we would be comfortable with this. So thanks for your patience. Thanks for joining us. Stay tuned for tomorrow 9 p.m. Thank you, director, and thanks a lot, Murtaza sir. Thank you, sir.